Every year, lakhs of students appear for medical exams in India.
Over 18 lakh candidates have applied to take.
And India majorly hosts two major medical exams, that is NEET UG and NEET PG. The first exam is for those who wish to pursue medical in their graduation year, whereas the second is for those who wish to pursue post-graduation in their medical field. Now, as soon as a student completes his MBBS degree, he is supposed to do internship for a specific period of time. Then later on, he will be granted with a license of practicing independently in anywhere in the India.
It was all okay till 2018.
In 2019, National Medical Commission Bill was introduced with this concept of next exam.
Sir, I move that the National Medical Commission Bill as amended by Raj,
which tells that every Indian medical student and every foreign medical student who wish to pursue post-graduation in medical field should have to undergo these exams. To get into MBBS, we have only one entrance exam, that is NEET UG. But to pursue a post-graduation, we have a lot more exams like NEET PG, which is one of the most majorly occurring exam. Other than this, we have exams like AIMS, JIPMER, NIMANS and FMGE for foreign medical students if at all they wanted to practice medicine in India. And now, all these exams will be replaced by one single exam, that is next exam. What is next exam? What is the pattern for next exam? How is next exam different from NEET PG? And what are the consequences that you will be facing if at all you fail in the next exam? And who will be writing next exam for the first time? And what is the need for next exam? All this we will be discussing in this video.
The exam, several protests were held in
कम से कम 10 साल की practice.
I would request the government to think about it. Maybe in the next session would come.
Hey everybody, those of you who don't know, this is Sainath, a presently first year MBBS student at James Gulvarga, and thank you so much for watching this video. Next, which means National Exit Exam. It is an exit cum licensing exam for all the medical students in India. And now it's going to serve you dual gateways. Number one, all medical students will be required to pass this exam in order to get their MBBS degree and obtain a license for practicing independently in India. Number two, in addition to that, all admissions to post-graduation courses will be based on the merit list of this next exam. And now this is going to make a major difference. Once a student completes his final year, he will be undergoing internship, whereby he will be getting a license to practice anywhere in India. There was no such exam which would overall check your clinical skills and provide you a license. But now there is an exam. As of talking now, your final year exams will be replaced by next step 1. And once you clear that, thereby you are allowed to go to internship. To make this more clear, let's understand the pattern of next exam. The next exam is going to be very different from the traditional exams of FAMG and NEET PG. It will have two different exams which will be called as steps. That is next step 1 and step 2. Next step 1 will be a theoretical exam which will contain one or more types of MCQs along with long answer, short answer and all these questions, and it will be a computer based exam and it will be centralized all over the India. This examination will have 6 papers covering subjects of third year and final year, that is both part 1 and part 2. As like medicine and allied disciplines, surgery and allied disciplines, ophthalmology, gynecology, obstetrics, pediatrics, and it will even have applied aspects of your first year and second year. Next step 1 exam will be held twice a year, that is in May and November. And there is no such restrictions to the number of attempts to appear in next step 1, provided the condition that the candidate must have been passed next step 1 and step 2 within 10 years of him joining the MBBS course. About division and type of questions in next, it would be like problem solving and analytical skill types, which will comprise of 60 to 70%, and comprehension type questions will comprise of 20 to 30%, and recall type questions will comprise of 5 to 15%. And your level of knowledge in order to pass this exam should be like must know questions you should be knowing about 60%, nice to know questions you should be knowing about 30%, and may know questions you should be knowing at least of 10%. To pass this next step 1, you should be scoring at least of 50%. And this is all about next step 1. And now talking about next step 2. Step 2 will be a practical, clinical and viva voice based examination. And it will be based on subjects that you have written earlier in the next step 1. And for your surprise, there is only one grading process, that is whether you pass or fail in next step 2. This step 2 examination will be conducted by respective universities and institutions under the guidelines given by the commission. According to the latest report, it is told that 2019 batch will be the first batch to ever appear for, and to be more precise, this information is not at all confirmed by them. Think about what is the need for this next examination. In order to keep a check on medical students' clinical knowledge and abilities along with theoretical knowledge, they have taken this decision of implementing next examination and guaranteeing that all doctors have the capabilities required to deliver high quality healthcare. And now one of the most asked questions, that is what happens if someone fails in next exam. There is nothing much to worry because there are even supplementary exams for next exam. No matter how hard this exam is going to be, but your hard work and determination will surely take you to the peaks. Thank you for watching.